Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Presentation of fibroid. The most common presentation of fibroid is an asymptomatic or incidental finding. The most common symptom of fibroid is menorrhagia. In endometriosis, the patient presents with pain, dysmenorrhea, and dyspareunia. In a polyp, the polyp can show irregular bleeding or intermenstrual bleeding. The most common fibroid to cause menorrhagia is submucosal fibroids. Fibroids can cause dysmenorrhea, but they can never be the chief complaints. Fibroid can never cause dyspareunia. If there is pain in the fibroid indicates that the fibroid is undergoing degeneration. Pedunculated serous fibroid can undergo torsion. Pressure symptoms. The most common cause of pressure symptoms is subserosal fibroids. If there is fibroid can cause chronic pressure or it can compress the rectum causing constipation. The fibroid can also cause urinary symptoms. The most common fibroid causing urinary symptoms is cervical fibroid. Fibroids can also cause infertility and recurrent abortion. Most common fibroid causing infertility and recurrent abortion is submucosal fibroids. This is due to the prevention of implantation of the sperm. Fibroids are the sole cause of infertility, and this fibroid has a sole cause of infertility is seen in 1 to 3% of cases.
thank you and thank you for watching.